Topic of our today's lecture: model analysis. First of all, model analysis is one of the essential diagnostic aids. Model analysis are used for determination of space discrepancies in the arc. For example, to determine the difference between the space available and the space required for tooth alignment. Aids in the decision to opt for either arch expansion or extraction. The study model helps visualize three-dimensional view of the maxillary and mandibular dental arches in sagittal, vertical, and transversal planes. What things we need to perform a model analysis? First of all, there must be well-prepared study models. Vernier calipers or divider. Of course, a ruler and a long orthodontic stainless steel ligature. What about classification of model analysis? All model analyses are divided into three main types. Analysis used to assess the need for extraction. Analysis used to assess the need for arch expansion, and mixed dentition analysis. Now, what types of analysis used to assess the need for extraction? We know there are two types of analysis. Analysis for maxillary arc perimeter analysis, and mandibular arc, non-scarce analysis. Now let's talk about maxillary arc analysis. Arch perimeter analysis is done on the maxillary arc, and two measurements are required. First measure: calculation of space available. We need to pass the wire from the mesiobuccal line angle of maxillary right first molar along the cusps and incisal edges of the anterior teeth to the left quadrant until the mesiobuccal line angle of the left maxillary first molar. Then we need to mark the wire, straighten it, and then measure the wire to available. It was first measure. But please, don't forget that in case of proclined incisors, we need to pass the wire in the cingulum region more orally. But in case of retroclined incisors, we need to pass the wire more labially to them, like a smooth curve. And second measure, calculation of space required. We need to measure the mesiodistal dimension of all the teeth mesial to the first molar, from right first premolar till left first premolar, and calculate then their amount. But please, doctors, nota bene, the measurement of the mesiodistal dimension of the maxillary teeth should be carried out in the widest area, the equator. On buccal teeth, equator is near half of height crown pads, and on the frontal teeth the same, more close to half of height of frontal teeth, the widest area of upper teeth. And what interpretation of arc perimeter analysis in the upper dental arc? The difference between the space required and space available gives the arc discrepancy or excess. If the tooth material is more than the arc length, the space available for alignment is insufficient, resulting in crowding. If the tooth material is less than the arc length, then there can be spacing. On this table, they are shown interpretation of results. If arc length discrepancy is from 0 to 2.5 millimeters, we can correlate this inference by proximal stripping to reduce the minimal tooth material excess. If arc length discrepancy or deficiency is from 2.5 to 5 meters, extraction of second premolars is indicated. And if arc length discrepancy will be more than 5 millimeters, extraction of first premolars is usually indicated. Please, doctors, notice that they're not obviously actions. They're only options. To get this space, we can use another orthodontic techniques like multi-loop, edgewise arch wire technique, or we can use microimplants to distalize buccal teeth to get required space. Next analysis, mandibular arc analysis, Nance caries analysis. What does it mean? This analysis carried in a lower dental arc, and the arc length tooth material discrepancy can be calculated with the help of caries analysis. Methodics of this analysis is similar to analysis in the upper dental row. So, Nance caries analysis procedure. First step, determination of arc length, total space available. We need pass the wire from the mesial-buccal line angle of mandibular molar one side to along the buccal cusps and incisal edges of the anterior teeth to the opposite quadrant until the mesial-buccal line angle of the another mandibular first molar. Then we need mark the wire, straighten it, and then measure the wire to give the space available. But in case of proclined incisors, we need to pass the wire in the cingulum region, more labially. Or, in opposite situation, in case of retroclined incisors, we need to pass the wire more labially to them, like a smooth curve. Interpretation of non-scaris analysis. We need to perform second step, determination of tooth material, calculate, or total space required. Measure the mesiodistal dimension of all teeth mesial to the first molar, and add the values. This value gives the total space required. And third step, determination of discrepancy. Similar table for lower dental arc. In case of lower dental arc length discrepancy from 0 to 2.5 millimeters, we can use interproximal reduction to reduce the minimal tooth material excess. If lower arc length discrepancy will be from 2.5 to 5 millimeters, we can propose for our patients extraction of second premolars. But if patient will have severe deficiency of space, more than half millimeter, we can propose for our patients extraction of first premolars, and in that way get needed space. Doctors, please don't forget that they are shown only options. How can we solve problem with space deficiency? We can, instead of extraction, perform distalization by unremovable distalizators. We can perform distalization with orthodontic mini screws or TATs, temporary anchorage devices. We'll tell with you about temporary anchorage devices next semester. I have a lecture about it. Or we can use multi-loop edgewise edge-wire technique. This technique is more difficult for doctor, more difficult for patient, but very effective. But please, nota bene, the measurement of the mesiodistal dimensions of the mandibular teeth should be carried out at the widest area, the equator, and the area of molars, premolars, and canines. But the widest area of lower incisors, the incisor H. Instead of in upper dental roof, the widest area of incisors is equator. Please remember it. Next group of analysis used to access the need for arch expansion. And the Ashley-Howe analysis, Pond's analysis, Linderhart analysis, Korkhaus analysis, and maybe the most famous Bolton's analysis. I would like to notion you that first group of analysis was to determine and to correct length of dental arches deficiency. But this group of analysis we need perform to establish widest on dental roof. And first analysis, Ashley-Howe analysis. Ashley-Howe analysis is usually done in the maxillary arc. Howe considered the crowding of teeth to be the result of deficiency in arc width rather than arch length. Howe found the relationship to exist between the total width of mesiodistal distance of teeth anterior to the permanent second molars and the width of the dental arc in first premolar region. Procedure of Ashley-Howe analysis. First step, determination of tooth material. The similar step with previously analysis. We need to measure mesiodistal width of all the teeth anterior to the permanent second molars, frontal 10 teeth, from distal part of second premolar till distal part of opposite second premolar. With the help of calipers, and all the values are summed up. Please notice, doctors, that earlier we measured length of dental row with cusps and incisal edges, but this analysis is performed with measure total width of tooth, width in equator region. Second step, determination of premolar diameter. Distance or arch width from the tip of the buccal cusp of one first premolar to the tip of the buccal cusp of opposite first premolar. Third step, determination of premolar basal arc width, abbreviation PMB-AW. Measurement of width from canine fossa of the side or of one side to another gives us the width of the dental arc at the apical base or junction between the basal bone and the alveolar process. Do you remember? Yes? That fossa canina in Latin, it is area of maxillary bone between canine and first premolar, we need to know this area, because in case of sinusitis, we can get access to maxillary sinuses here, because bone of maxilla is the most thin in this area. And two inferences of Ashley-Ho analysis are derived. Inference 1. Comparison of premolar basis arc width and premolar distance. In case if PMBAW, or distance between fossa canina, is more than distance between buccal cusps of first premolars, it means that arc expansion is possible. But in opposite situation, when distance between right and left fossa canina is less than premolar distance, it means that arc expansion is not possible. And second interference, relationship between the PMBAW and distance between premolars in peasants. This relationship must be 44%. And Ashley-Ho proposed a formula to calculate this relationship, and what we need to do, how we need to explain that values. Sorry. In case when this number is 37% and less, we cannot expand. In case of this number more than 44%, we can do it. Next analysis, Pond's analysis, or Pond's index. Pond in 1909 proposed a method of determining the ideal dental arc width in premolar and first molar area based on the sum total of upper maxillary incisors. This index helps in determining whether the dental arc is narrow or is normal in the premolar and molar region for a given sum of incisors. Determining the need for lateral arc expansion, and determining whether the expansion is possible or not at the premolar and molar regions. What procedure of this analysis? First of all, we need to calculate sum of incisors. The sum of mesiodistal width of the first of the 4 maxillary incisors is determined. Then, second step, we need to measure premolar value. Width of the arc in the premolar region from the distal pit of upper first premolar to the distal pit of the opposite first premolar. Please notice, doctors, Instead of previous analysis, where we measured this distance between vestibular cusps. In point analysis, we need to measure this distance between distal pits, right and left first premolars. And third step, measured molar value, or MMV, width of the arc in the molar region from the mesial pit of the upper first molar to the mesial pit of the opposite first molar. And then we can calculate premolar value, calculate the premolar value or the ideal arc width in the premolar region. Must be 80. If we sum of first frontal teeth, sum of incisors frontal teeth, divide into 18 and multiply into 100, we'll get normal value. And calculated molar value of the ideal arc width in the molar region. It will be 64. And in case if calculated premolar value or calculated molar value will be more than premolar value or molar value, more than 80 or CPV or more than 64 calculated molar value. It indicates the need for expansion. Please notice, doctors, the opposite correlation. If our results will be more than normal numbers, it means that arc is narrower. For example, if calculated distance between premolars will be more than 80, it means that upper dental arc is narrower in first premolar area. And the same situation with molars. If we get this number more than 64, it means that upper dental arc is narrower in molar area. Pons analysis gives us an approximate indication of the degree of narrowness of dental arches in case of malocclusion and the amount of lateral expansion required for the arc to be of sufficient size to accommodate the teeth in a perfect alignment. But there are some limitations for Pons analysis conduction. First of all, missing maxillary laterals or peck-shaped laterals, abnormal shape of upper second premolars. And of course, we cannot calculate Pont index in case of absence of first premolars or first molars. Moreover, it does not take skeletal mal relationships into consideration. Next analysis used to assess the need for arch expansion, Linder-Hart analysis. So, doctors, it is not my mistake. You can see similar picture like for Pont analysis. Linder-Hart proposed an index very similar to that of Pont's analysis, but he made variation in the formula to determine the calculated premolar and molar values. And in opinion of Linder-Hart, calculated premolar value or normal value is 85 instead of 80 in Pont's analysis, and calculated molar value is 65 instead of 64 in Pont's analysis. Next analysis, Korkhaus analysis. As can you see, similar picture. But Korkhaus, yes, this analysis is similar to Pont's analysis, but only difference is that it makes use to Linder-Hart's formula to determine the ideal width in the premolar and molar regions. And in addition, this analysis also utilized a perpendicular distance between midpoint of incisors. According to Korkhaus, for a given width of the upper incisors, a specific value of the distance between the midpoint of the interpremolar line to the point between the two maxillary incisors should exist. And increased distance between one and second point, it means proclination of upper incisors, and opposite correlation in case of decreased distance between one and second point. It means retroclination of upper incisors. Korkhaus proposed and add correlation between these distances. And in opinion Korkhaus, distance between midpoint of interpremolar distance till midpoint between central incisors must be similar with half of this distance. And the most widespread, Bolton's analysis. Inference of Bolton's analysis. It helps to determine the disproportion between the size of mandibular and maxillary teeth. In well-aligned upper and lower arches with normal overjet and overbite. I hope you remember What does it mean, overjet and overbite? Overjet, it is distance between vestibular surface of lower central incisors and palatal surface of upper central incisors. Instead of overbite, it is vertical covering lower incisors by upper incisors. Overjet, it is horizontal measure, but overbite, it is vertical measure. There exists a definite proportionality of tooth size between the two arches, upper and lower. If the proportionality is met, the maxillary definition fits well with the mandibular. Sorry, I told definition, dentition. The presence of disproportionately sized teeth in either arc can make it difficult to obtain an occlusion with good alignment, ideal overjet, ideal overbite, and a class 1 molar relationship. Procedure of Bolton's analysis. First step, we need to calculate sum of maxillary 12 and mandibular 12 teeth from distal surface of first molars one side till the same area of opposite side, and measure and sum it up. Then we can calculate sum of maxillary and mandibular 6 anterior teeth from canine to canine. The mesiodistal width of all the teeth mesial to the maxillary mandibular first permanent premolars are measured and summed up. Second step, determination of overall ratio. Bolton states that the sum of width of the mandibular teeth anterior to second permanent molars should be 91.3% of the width of maxillary teeth anterior to second permanent molar. And Bolton proposed a formula. Overall ratio is sum of mandibular 12 teeth to sum of maxillary 12 teeth multiplied into 100. A ratio of less than 91.3% indicates maxillary tooth material excess. Instead of opposite situation, a ratio of more than 91.3% indicates mandibular tooth material excess. There are shown formulas for determining 12 maxillary tooth material excess and mandibular tooth material excess. Formulas are similar for upper and lower dental rows. But we can use not 12 teeth, but we can use only 6 frontal teeth. In that case, third step will be determination of anterior tooth ratio. Bolton states that the sum of mesiodistal width of mandibular incisors should be 77.2% of the mesiodistal width of maxillary incisors. And canines, of course. And formula is anterior ratio. It is sum of mandibular 60s divided into sum of maxillary 60s and multiplied in 100. And inference of that results, a ratio of less than 77.2% indicates maxillary tooth material excess, but a ratio of more than 77.2% indicates mandibular tooth material excess. And formulas for determining 6 maxillary and mandibular tooth material excess are similar. And last group of model analysis or types of model analysis, mixed dentition analysis. Main of them, the Moyer's mixed dentition analysis, Tanaka and Johnston analysis, Nance mixed dentition analysis, and radiographic method. The purpose of mixed dentition analysis is to evaluate the amount of space available in the arc for succeeding permanent teeth and necessary occlusal adjustment. This is either done with the help of prediction tables or radiographic assessment of width of interrupted permanent canines and first and second premolars. Thus, Moyer's analysis is based on casts and prediction tables, whereas Hickson's and Oldfeather's is based on radiographs as well as prediction tables. And they are shown different analysis depends on methodics. Analysis based on erupted teeth on casts and prediction table. The Moyer's analysis, Korkhaus analysis, Hickson's and Oldfeather's analysis, Stanley's and Kerber's analysis. Analysis based on radiograph, the Nance's mixed dentition analysis, Hakaba's analysis, Hickson's and Oldfeather's analysis, and analysis based on regression equation, the Tanaka and Johnston analysis, and Hickson's and Oldfeather's analysis. Now let's talk about Moyer's mixed dentition analysis. The analysis requires only study models. By measuring the mesodistal width of erupted lower incisors, by measuring the interrupted width of erupted lower incisors, one can predict the width of unerupted upper and lower canines and premolars from 75% level of the probability chart. First step of this analysis, space required. Measure the dimension of all 4 lower incisors and sum it up. Using the Moyer's probability chart, find the total mesodistal width of upper and lower canine and premolars from the upper and lower charts at 75% probability for the given lower incisor dimension. Second step, space available. Measure the distance between the distal surface of permanent lateral incisors and mesial surface of permanent first molar. Determine the amount of space required for the proper alignment of mandibular incisors. The amount of space left behind gives the space available. Next analysis, Tanaka's and Johnson's analysis. It is a method to predict the width of unerupted canine and premolar using the width of lower incisors. This method has good accuracy despite a small bias towards overestimating the unerupted tooth size. Formula of this analysis is based on the 75 level prediction values. The sum of width of mandibular permanent incisors is measured and divided by 2. For the lower arc, 10.5 mm is added to the result. For the upper arc, 11 mm is added to the result to obtain the total estimated width of the canines and premolars. Next analysis, Nance mixed dentition analysis. This analysis is similar to arc perimeter analysis of the permanent dentition. What armamentarium we need to have to perform this analysis? Of course, dental casts, Boley gauge caliper and millimeter ruler, periapical radiograph. What advantages of this analysis? It results in minimal errors. It can be performed with reliability. And it allows analysis of both arches, upper and lower. But this analysis has some limitations. It is time-consuming, of course, and complete mouth radiograph is needed. For child, it is so hard radiographic loading. At first, we need to find space available. Using a wire, we need to measure the arc perimeter from the mesial surface of permanent first molar to the mesial surface of the permanent first molar and the other side, opposite side. And we need to compare the space required and space available to arrive at the arc length discrepancy. And space required. We need to measure the mesiodistal width of the erupted permanent teeth, measure the width of each unerupted tooth, cuspids, and bicuspids from the intraoral panoramic radiograph, and the total mesiodistal width of all the teeth in each quadrant will indicate space required to accommodate the permanent teeth. And next method, radiographic method. This method uses a radiograph to predict the width of the unerupted teeth, and by this formula y1 is x1 multiply y2 and divide into x2, where y1 width of the unerupted tooth whose measurement is to be determined, y2 width of the unerupted tooth on the radiograph, x1 width of the tooth that has erupted of the cast, and x2 width of the tooth that has erupted. measured on the radiograph. And in conclusion, I would like to tell you that mixed dentition analysis forms an integral aspect of orthodontic diagnosis to determine whether the treatment plan is going to involve serial extraction, space maintenance, space gaining, or simply periodic observation of the patient. Next analysis, Courthouse analysis. As can you see, similar picture. But Courthouse, yes, this analysis is similar to Pond's analysis, but only difference is that it makes use to Linderhart's formula to determine the ideal width in the premolar and molar regions. And in addition, this analysis also utilized a perpendicular distance between midpoint of incisors. According to Courthouse, for a given width of the upper incisors, a specific value of the distance between the midpoint of the interpremolar line to the point between the two maxillary incisors should exist. And increased distance between one and second point, it means proclination of upper incisors, and opposite correlation in case of decreased distance between one and second point. It means retroclination of upper incisors. Courthouse proposed and add correlation between these distances. And in opinion Courthouse, distance between midpoint of interpremolar distance till midpoint between central incisors must be similar with half of this distance. And the most widespread, Bolton's analysis. Inference of Bolton's analysis. It helps to determine the disproportion between the size of mandibular and maxillary teeth. In well-aligned upper and lower arches with normal overjet and overbite. I hope you remember what does it mean overjet and overbite. Overjet, it is distance between vestibular surface of lower central incisors and palatal surface of upper central incisors. Instead of overbite, it is vertical covering lower incisors by upper incisors. Overjet, it is horizontal measure, but overbite, it is vertical measure. There exists a definite proportionality of tooth size between the two arches, upper and lower. If the proportionality is met, the maxillary definition fits well with the mandibular. Sorry, I told definition, dentition. The presence of disproportionately sized teeth in either arc can make it difficult to obtain an occlusion with good alignment, ideal overjet, ideal overbite, and a class 1 molar relationship. Procedure of Bolton's analysis. First step. We need to calculate sum of maxillary 12 and mandibular 12 teeth from distal surface of first molars one side till the same area of opposite side, and measure and sum it up. Then we can calculate sum of maxillary and mandibular 6 anterior teeth from canine to canine. The mesiodistal width of all the teeth mesial to the maxillary mandibular first permanent premolars are measured and summed up. Second step, determination of overall ratio. Bolton states that the sum of width of the mandibular teeth anterior to second permanent molars should be 91.3% of the width of maxillary teeth anterior to second permanent molar. And Bolton proposed a formula. Overall ratio is sum of mandibular 12 teeth to sum of maxillary 12 teeth multiplied into 100. A ratio of less than 91.3% indicates maxillary tooth material excess. Instead of opposite situation, a ratio of more than 91.3% indicates mandibular tooth material excess. There are shown formulas for determining 12 maxillary tooth material excess and mandibular tooth material excess. Formulas are similar for upper and lower dental rows. But we can use not 12 teeth, but we can use only 6 frontal teeth. In that case, third step will be determination of anterior tooth ratio. Bolton states that the sum of mesiodistal width of mandibular incisors should be 77.2% of the mesiodistal width of maxillary incisors. And canines, of course. And formula is anterior ratio. It is sum of mandibular 60s divided into sum of maxillary 60s and multiplied in 100. And inference of that results, a ratio of less than 77.2% indicates maxillary tooth material excess, but a ratio of more than 77.2% indicates mandibular tooth material excess. And formulas for determining 6 maxillary and mandibular tooth material excess are similar. And last group of model analysis or types of model analysis, mixed dentition analysis. Main of them, the Moyer's mixed dentition analysis, Tanaka and Johnston analysis, Nance mixed dentition analysis, and radiographic method. Thank you, doctors, for your kind attention.